I'm joined now by Dr. Stephen Thomas in New York. He's Chief of Infectious Diseases at the State University of New York, Upstate Medical University. Thanks so much for being with us. Let me ask you, does it frustrate you that kind of the divide in effective response can, in many ways, be drawn along political lines?
It is frustrating. Infectious diseases are apolitical, right? And public health interventions to combat infectious diseases also should be apolitical. And so it is very concerning to me, and it is disappointing that unfortunately the number of cases that we see, the morbidity and mortality associated with those cases seem to be associated somewhat with the political approaches to combating the epidemic in a particular region of the country or a particular state.
Right. That's why I think you hear so much criticism over the federal response being so kind of vague, because it should be one blanket policy for the entire country. All Americans are affected in the same way, basically. We're all, susceptible to the same virus. But still, it was kind of left up to the states, and now we have this hodgepodge of responses in different areas. But I want to ask you something else. If you can help us with this, help us really understand the psychology about wearing masks in the United States. For those who refuse, why didn't they protest, for example, banning smoking indoors or being forced to wear seatbelts in their own cars? That's the government, in a sense, controlling their personal choices in the interest of saving lives. They go for that, but they're so rabidly against wearing these masks.
That's a very good point. Or wearing helmets when you ride on a motorcycle. I think part of the problem is that people are conflating needing to wear a mask and the public health good that wearing a mask does with some sort of loss of autonomy or some sort of loss of some personal right. We know they are mixing up the idea of wearing a mask with First Amendment rights, Second Amendment rights, these sorts of things. I was in the Army for a long time. I had the experience of living in Asia for up to 6 years, and wearing masks, is part of normal culture. And so it was very surprising to me that certain groups of people would react so vehemently against wearing a mask.
So what would you like to see done then? Preferably, I guess, at the federal level, to start imposing one policy to protect all Americans. Where would you start with which recommendations to protect people from catching this virus?
Yeah, so at this point in time, my answer would have been different to, maybe 6 to 8 weeks ago, because although the entire country is undergoing this epidemic, infectious diseases are still very much sort of a local phenomenon, and you have to take the local context into consideration when you're making policies. Now the cat's kind of out of the bag, and so I agree that there should be some very basic principles that the federal government agrees upon in terms of how to prevent, when an infected person comes in contact with an uninfected person, how to prevent that transmission from occurring. So again, very simple things. Universal masking, I think, is a must, number one. Number two, physical distancing when possible. That means more than 6 feet in between people. Three, continued pressure for hand hygiene, right? Because people touch their faces all the time, and we know that when people are touching their eyes, their mouth, their nose, that they can get infected through that route. And then number four, in places where people have to come to gather, whether it be essential employees at work or if it's in a daycare kind of setting, that people are screening their own health prior to showing up to those venues, or they're screening the health of their family members, kids, for example, before they come up, show up to those venues. Do they have a fever? Do they feel any different than they normally do? And if they do, they go seek medical care. Just those four basic principles, if those were communicated as important and necessary at the federal level, then the states and the governors and the counties and their county executives could implement them at the local level based upon the context of their situation. It really is not a difficult concept.
Okay, Dr. Stephen Thomas joining us there from New York. Thanks so much for that.